Hello, my name is Dawn Kinnaman, and today we're going to be talking about sex at Texas Tech. Before beginning this education module, you should have completed the pre-test survey and the pre-test questionnaire. The pre-test survey is a short 5-question survey with no right or wrong answers. It's basically asking what you believe your personal risk is of obtaining a sexually transmitted infection. The pre-test questionnaire contains 27 questions. The options are true, false, and don't know. If you score greater than 90%, you don't have to do any post-test. However, I do recommend that you view the presentation. If you score less than 90%, you must complete this training and the post-test. The objectives of this training are to provide baseline information and improve overall knowledge of STIs. It's also to increase your knowledge of signs and symptoms and methods of prevention, and to increase your awareness and identify options for treatment for STIs among college students. What is an STI? Sexually transmitted diseases, also known as sexually transmitted infections, are most often acquired by sexual contact. Transmission occurs in a variety of ways. Organisms may pass from person to person in blood, semen, or vaginal and other bodily fluids. Due to the lack of symptoms present and the lack of awareness of disease, it has been labeled an infection. For example, students may not have symptoms of HIV for months after infected. With the exception of HIV and human papillomavirus, HPV, most sexually transmitted infections are easily treatable, specifically gonorrhea and chlamydia, which are treated with an oral antibiotic. Common misconceptions among college students include you cannot obtain an STI if you have anal sex. This is simply not true. You can obtain the same STI regardless the method. Anal sex actually increases your risk of obtaining hepatitis B. Any STI can be obtained regardless of method. Other misconceptions are that you can't get genital herpes unless the person has open sores. This is not true. Genital herpes is a virus that has no cure. What is the cause of STIs? STIs can be caused by 3 things: bacteria, parasites, and viruses. The specific etiology, which is the cause of STIs, are identified above. The State Health Department is required to report gonorrhea, syphilis, chlamydia, and HIV. Each infection is caused by a different virus, bacteria, or parasite. No 2 infections are caused by the same one. Common misconceptions of causes include frequent urinary tract infections, also known as a UTI. A UTI cannot cause an STI. For example, HPV cannot cause HIV. In 2011, Texas ranked 3rd among the 50 states in the number of HIV diagnoses. The prevalence of chlamydia among adolescents aged 13 to 24 nationally is nearly 3 times the prevalence among adults aged 25 to 39. Of the nearly 4,000 Texans aged 15 to 24, 222 have syphilis, 282 have chlamydia, and 323 have gonorrhea, as you can see on the chart. These numbers are concerning and fail to account for a true and accurate number of all STI infections because most individuals within the age population are unaware they have the disease, may be spreading it when having unprotected sex, may fear being screened for the infections, and may not be receiving any medical treatment. Most STIs do not have symptoms. Therefore, you don't know you have the infection. If symptoms are present, most commonly students will have drainage, burning during urination, or canker sores that appear to be like a blister. Simple antibiotics can be used for treatment of most STIs. Why do you care? What does this have to do with you? The highest rate of STIs in the United States occurs between ages 15 and 24. This age group accounts for approximately 1/4 of the sexually active population in the United States, yet represents half of the 20 million newly diagnosed STIs occurring every year. Lubbock County was on both of the top 25 list of the highest STI cases in 2014 for gonorrhea and chlamydia. Lubbock ranked 8th in gonorrhea, 11th in chlamydia, and 15th in syphilis out of the 254 counties in Texas. HIV is most prevalent in this age group. This past April, the Texas Department of State Health Services issued a syphilis alert for Lubbock County to encourage healthcare providers to increase screenings and help increase awareness, as the cases had tripled so far in comparison to the previous year. It is estimated 1 in 4 students will be diagnosed with an STI per year. The rate is so high that Texas Tech students have created a slang known as Raider Rash. Why is the rate so high here? Many college students believe they are invincible and that it won't happen to them. There are several contributing factors for the high incidence. First, the lack of knowledge. It is easier to get HIV if a person has another STI. Hookup sites such as Grindr have exploded into the largest and most popular all-male location-based social network out there. Grindr has over 2 million daily active users in 196 different countries. There has been a steady increase of casual sex among college students. Expedited partner therapy, known as EPT, is utilized by only select providers. EPT allows for medication for an infected person's sex partner without a physical assessment of the partner. Currently, in the wellness clinic, unless the patient is symptomatic, healthcare providers only ask about sexual activity on this health history form completed annually. This section only focuses on sexual activity and does not elaborate on STIs. There is not a standard process for obtaining the sexual history. So if you are diagnosed with an STI, ask your provider if they will be willing to use EPT to treat your partner as well. Failure to treat STIs can lead to devastating consequences. Gonorrhea and chlamydia left untreated results in infertility, affecting approximately 24,000 women in the United States. Long-term complications of syphilis include brain, cardiovascular, and organ damage. In mothers where syphilis were untreated due to unawareness of the infection, the infant mortality rate has been reported as high as 40%. HIV mortality rates in Texas were higher than the United States average. Other consequences include students infected with genital herpes. Where their overall health is not impaired, these women will have to have a C-section because herpes can be passed to the baby when going through the vaginal canal, regardless if open sores are present. Women with HPV can develop genital warts and have an increased risk of developing cervical cancer. STIs usually cause more health problems for women than men. STIs cost an average of $1.5 billion. Stop and think about that for a second. What would you do with $1.5 billion? It's up to you to protect yourself. Each individual that partakes in sexual activity is at risk of acquiring an STI. CDC and Department of Health and Human Services recommendations for prevention of STIs include abstinence, which is refraining from sexual activity, monogamous relationships with a partner known to be uninfected, latex condoms, vaccinations such as HPV and hepatitis B. Important considerations: condoms must be latex. Also, currently there are vaccinations for HPV and hepatitis B that can provide immunity. There are no vaccines for the most common STIs, such as gonorrhea, chlamydia, HIV, and syphilis. A person cannot receive immunity by exposure to the infection. For example, If you are diagnosed with gonorrhea and treated, you have no resistant immunity in the future. In fact, you are more at risk of obtaining an STI again. If you think you may have an STI, where can you go? The only way to know if you have an STI is to be screened and tested. Most STIs can be tested by providing a urine sample. There are also home tests you can purchase at stores such as Walgreens or CVS to test for select STIs. You cannot tell if you have an STI by the smell, drainage, or the way you feel. There are many places students can go to be screened for STIs. Any city health department provides screening and treatment. The Texas Department of State Health Services in Lubbock offers campus-wide screenings for free once a year. The City of Lubbock Health Department provides assessment, screening, education on further transmission, and treatment of STIs to all individuals in the community for only $20. However, they will never turn away students because of money. Students who are enrolled in school health insurance plans provided by TTU may not know the benefits provided under the Affordable Care Act. HIV and STI testing and treatment can be done for minimal cost to prevent the spread to other students. The Texas Tech Physicians Family and Community Medicine Clinic provides health services to students who are currently enrolled and have paid the student health fees as part of their tuition and fees. However, most students are covered on their parents' insurance plans. Students do not want their parents to know if they've been screened or treated for STIs. Providers at the Wellness Clinic on main campus can select to bill a visit to the university account where it does not state any specifics about your visit. It will appear on the university bill as a clinic visit. Who can you really trust? Stop and think about that for a second. Who can you really trust? In relation to HIV, specifically, Rule 97-134 states individuals who knowingly have sex when positive can be charged with assault with a deadly weapon or attempted murder. Refuse to become a statistic. Why should you care? Education and treatment of STIs saves lives and promotes overall health of the community. By receiving treatment, students are protecting others from exposure and aiding in decreasing the spread of infection. More than a century later, STIs continue to capture the attention of state, national, and worldwide populations. Although significant achievements in diagnosis, treatment, and prevention have been realized, STIs remain a major population health concern. Today, without knowledge of these tragedies experienced in the early years of the epidemics, new generations of Americans face the realities of STIs. The rate of STIs among college-aged individuals in Lubbock County is disconcerting at present. The impact of continued transmission is worrisome as infected individuals may not be aware of their contagion, may fear knowing, but continue to be sexually active. It starts with you. Refuse to be a statistic. After receiving this education module, please complete the post-test survey and questionnaire. Remember that your results are completely anonymous and cannot be traced back to any individual. Therefore, if you decide later not to release your results for the project, there's no way to know which results are yours. Thank you very much for participating today. I hope you will use this information to inform your peers to help us decrease the incidence of STIs among college students. For more information or any questions, feel free to contact me directly by email or cell phone. Thank you for your time today.